Good evening everybody, and welcome to this very impromptu live. I just wanted to come on and talk to you a little bit about the red flags for DLD. I'm not sure if you have seen the awareness campaign that's been running. I've seen quite a few posts today on Facebook. I'm not sure whether it's caught the news at all. I've not seen the news today, but today is DLD Awareness Day, and DLD stands for Developmental Language Disorder. And this is an invisible disorder that 1 in 14 children have. So that's 2 in every classroom, and it is a pervasive and disability or difficulty with language, specifically with language, and it can affect children very differently, but what it has in common is that the difficulties have gone on. They're affecting learning, they're affecting social communication, relationships, self-esteem, child's behaviour maybe, and those difficulties are causing problems across school. This is a diagnosis that wouldn't be given probably in the preschools, particularly not around 2 or 3, because it is a difficulty that is identified because it's ongoing. So this is not something that you'll see a speech and language therapist for once and you'll get a diagnosis of DLD. But we know there's definitely red flags in the early years, and that's what I wanted to pop on here and talk about today, because I'm concentrating on children that are in those very early years, the kind of 18 months to 3-year-olds. So if we think about children that are 18 months to 24 months, so 1.5 to 2 years of age, what we would be looking for and what we would identify as red flags is the child being a late talker, and particularly having difficulty with understanding language. So we see lots of children in the early years who have got very good comprehension and their expressive language is lagging a bit behind, and what we know is that the outcomes for those children seem to be that they resolve quicker and they resolve more fully before school. But children who have difficulties with comprehension are more likely to go on and have difficulties long term. We'll talk a little bit more about that, because it's not necessarily, a given that if that's the case, then that's what you can expect, but it's just a red flag at this stage. We also know that children who have poor gesture are more likely to go on and have difficulties with language development and with difficulties with language for a longer term. That's another red flag. So if you've got an 18 month to 2-year-old who isn't putting their hands up to be picked up, or isn't kind of indicating that they want something to eat, and they're not talking as well, that could be a red flag that you might want to bring up when you have a speech and language assessment, and it would be worth getting one if that was the case. We also know that a family history is a red flag, so these difficulties can run in families. Not always the case, but definitely if there's cousins or parents or siblings that have had difficulties with language, that's another thing to add to your to the diagnosis, to responding to speech or sounds, and obviously the first thing you'd want to do is check the child's hearing. But if hearing is fine and children aren't responding to their name, they're not responding to the things that you're saying, again, that's another red flag. And maybe having minimal or very little attempt to communicate. Now, lots of these things that I've talked about are red flags for autism as well, and that's why in these early years people are not going to, don't rush at giving a diagnosis, because actually what your child could be displaying is signs of having a pervasive language disorder, but not a social communication difficulty, and really needs a really good assessment to be able to tease those two out, and probably wouldn't be possible at this kind of 18 months 2 level in most cases. So by the time your child is getting towards 2 or 3, the red flags that we're looking between 2 and 3, we're looking out for these following red flags. So we're looking at minimal interaction, we're looking at no intention to communicate, so they're not trying to communicate with you, however difficult it is for you to understand them. We're looking for that effort to communicate. They might have no words between the ages 2 and 3. Minimal reaction to spoken language, so you might be able to call their name, you might be able to ask them to do things and they're not responding. They might be very reliant on visuals, so they're looking at you, they're looking at what gestures you're doing, they're looking at if you're pointing to something or if you're showing them in another way, and then they understand. But when it's just down to language, that's when they're finding it really tricky. And we sometimes see a regression or a stalling of language. So we'll hear parents say, oh, they were doing really well, they had a handful of words and now they haven't. And again, anybody who's in this situation at the moment will also know that that's a red flag for autism. And again, this shows how, you know, we need to kind of really get to know and work with the child to know whether this is an autistic kind of difficulty, an autistic spectrum disorder, or whether it's a language disorder, and those two things have to be teased out. And then at 3 to 4, we're looking for children linking ideas together, so 2 words together. We're looking for, a red flag would be that a child doesn't understand simple instructions, so they're still really struggling with that comprehension, or that their speech sounds are so poor that people in the family, mums, dads, grandparents, are really struggling to understand them. And so those are the red flags that we would be looking for between 2 and 3. So if you've got a child that's having those kind of difficulties, if this is ringing true with you, I would really recommend that you've got an assessment by a speech and language therapist. And depending on what country you're in, that will depend on how you would go about that. But your family doctor, your GP, your health visitor would be the first person to talk to about that. I'm also happy if you want to ask me any specific questions. You know, lots of people are messaging me directly or, you know, putting comments after, and I'm trying to get back to everybody about that and helping them to understand. So there's a few things, I've written a few notes, I keep looking down, but there's a few things just to think about. So all children are different, so all children with DLD are different. You know, we can't say that a child with DLD looks like this with X, Y and Z. It presents very differently for different children, and the impact that has is different for different children. So, you know, that means that the approach that they need is very different, and there's lots that we can do. There might not be a cure for a developmental language disorder. This is something that children will probably struggle with throughout school and into adult life. It's something that is persisting and is difficult. But that doesn't mean that there aren't strategies, there aren't ways to help them, there aren't different ways to teach. There's lots and lots of things that we can do to support children with these difficulties. So it's really important for somebody to really get a good assessment and tease out where your child's up to. It's not about parenting. This is not because the parents have done anything wrong. This is not because the child has not been in a great environment. This is not because someone hasn't spoken to them, or, you know, we mustn't kind of give these children that label, because that's a really difficult situation for parents. And, you know, we know that these children can be in an amazing language environment, but just learning language is difficult for them. It's not caused by bilingualism, so if you have a child who's in a bilingual environment, don't think that because you're in a bilingual environment this is causing the language difficulty. Children who are bilingual definitely go through a process of learning language in a slightly different way, and, you know, if you want some more information on that, we can do a live on that later on. But this DLD is not caused by being in a bilingual environment. Now, if you are a child who has DLD and you're in a bilingual environment, what you see is those language difficulties are in both languages. So they find the home language or the father's language and the mother's language equally as difficult, or the home language and the nursery language equally as difficult. So it persists across all the languages that the children is exposed to. And so my main point to get across is, let's raise awareness. You know, this is probably more prevalent than autism or hearing impairment, but it's something that isn't often talked about. And so, you know, anything that you can do today to share any of the information. There is some great campaigns going. I've shared a couple myself, so you know, go ahead and share those as well. And let's raise the awareness for teaching staff, for parents, so that they can begin to recognise this earlier and help their child. If you've got any of the worries about these red flags, the best thing to do is seek help. Don't wait, because these children need intervention and they need help and support. They don't need a watch and wait situation. So, you know, do your best to try and get some support there. I hope you found this useful, and please share this video if you know anyone, or into any groups that where parents are hanging out that have got children with language difficulties, because these red flags might just give them a bit of a clue as to whether their child needs some ongoing help or not. Feel free to message me, and thanks so much for watching. Bye bye.